Hi, class. I'm presenting my flashcard on scleroderma. Scleroderma, the disease process, is a skin disorder that is localized, but it may also be systemic, and it affects the versa. And the primary cause is not known, but increased collagen deposits are observed in all cases. The pathology is that the collagen deposits are in the arterioles and the capillaries. They reduce the blood flow to the skin or internal organs. And collagen deposits with inflammation and fibrosis, along with the decreased capillary network that developed are in the skin. And there's often co-current diagnoses of Raynaud's syndrome and something called Crest syndrome as well. The risk factors are more common in women than in men. The age, usually these cases of scleroderma present before the age of 30, and systemic types of scleroderma are typically diagnosed between ages of 30 to 50. Race can be a factor in the risk factors. Localized types of scleroderma are more common in people of European descent than in African Americans, and also Choctaw, Native Americans, and African Americans have a higher risk of the systemic form of scleroderma. Environmental exposures also play a cause. Some environmental influences can put people at greater risk for developing scleroderma, especially men exposed to silicas have appeared to have higher risk for developing scleroderma. Being around certain solvents and taking certain drugs can also increase the potential for developing the disease. Genetics plays a role, but it is not passed on from a parent to a child, and it's rare for other immediate family members to also get scleroderma. It's common for family members, however, to have other autoimmune diseases, such as thyroid diseases, rheumatoid arthritis, or lupus. Here's a picture of how the hands will typically look. There's a tightening and hardening of the skin, and patients can also present with something called calcinosis cutis, which is where the calcium deposits actually push through the skin and form like hard plaques. So you have hard, shiny, tight, and immovable areas of the skin. The fingertips are often narrowed and shortened, with the Raynaud's phenomenon being present, which is where the circulatory system from a neurological standpoint is kind of segmented. So you may have a finger or toe that will show up as white or bright red for Raynaud's phenomenon. The ability of facial expressions is often lost as the skin tightens, and the movement of the mouth and eyes may be impaired. And we talked about the calcifications that can also affect those microcirculations in various organs, essentially causing renal failure, intestinal obstruction, or respiratory failure related to pulmonary hypertension. One of the most common side effects of scleroderma with systemic scleroderma is ultimately lung disease, idiopathic pulmonary fibrosis, and respiratory failure. So though there is not one diagnosis and diagnostic test related to diagnosing the scleroderma, it's a physical examination, and the doctor may also order an antibody nuclear test, which is an ANA for a blood sample, which will let them know if any antibodies and blood proteins are in the blood. However, because our bodies develop antibodies for other reasons, this ANA test by itself does not determine a diagnosis of scleroderma. So it's important that with these blood tests also come the physical exam, and additional tests may be ordered, such as pulmonary function tests, an EKG, gastric motility tests, a CAT scan, and of course, also a skin biopsy. Here are my references, and that is scleroderma.